when founders are able to explain how do they play on the field today and what the long-term vision is in such a concise manner, I'm really excited.
Welcome to Money Moves, the show about raising money, making great investments, and building venture scale businesses. I'm Neil Devani, your host and the founder of Necessary Ventures, a firm investing in what the world needs. Each week, we'll talk to folks who have raised anywhere from $10 million up to billions of dollars. We'll learn how they return multiples of 10x to 100x or more to their investors. We dive into their stories, uncovering what worked and what didn't, learning from real experiences to understand the journeys of raising capital and rapidly scaling a business. Money Moves isn't just for those already in the game. It's also for anyone interested in the mechanics of startups and venture capital. Whether you want to raise money, make better investments, or just understand how it all works, Money Moves gives you the insights and advice you need to succeed. So join us each week and hear from those who've been through it all and learn from their journeys. Ben, thank you so much for joining me for an episode of Money Moves.
Of course, I'm happy to be here, Neil.
So what I would love to start with is the origin story of Oncology Ventures. It's such a great mission, great brand. Where were you when you first had the idea to start this firm?
I very much appreciate that. So I remember there were a few different moments where one of them, I was at Oncology Ventures prior, and I was doing a lot of the early stage general healthcare IT data investing. We got to know a lot of the different folks at different parts within the organization, and it just seemed like oncology was the top driver of both frustrations and opportunity for innovation. And I started putting together an oncology market map, and it was just the amount of companies being started in this space on just the data front. So not a new drug, not a new medical device, not a new therapeutic, was kind of staggering. And most other funds, I think I saw a lot of other groups maybe going to make one or two investments into this space. And so it just felt like a large unmet need for the non-drug and non-FDA approval type part of the cancer market. And then the other two pieces are, one, I'm a cancer survivor myself, and I was treated at Memorial Sloan Kettering with good health insurance. And it was just amazing how even with best in the world care and the right support system, there were so many different parts of it that could have been improved through what I think of as third-party data tech solutions. And the last piece in terms of where I remember we were in Colorado. I was with my family, and I told them this idea after I was on a run or something, nothing mentally, stimulating. It was more just a physical something where ideas are had, and I had their 100% support from day one. So it was nice to have everyone on board.
That's awesome. And what you're saying, right, in terms of the experience of seeing all of the opportunities out there and funds maybe being willing or interested to invest in one of those companies, what gave you the conviction that you could do something bigger than that? Because I imagine a lot of folks have said, oh, this is very niche or it's very specific. And it sounds like you're saying it's the opposite is true.
100%. I mean, this was one of the biggest risks that I think we were underwriting to is, are there enough companies and are there enough founders, right? And then not just founders and companies, but are there enough then buyers in the space? And I think it's one of those markets and industries where if you look at it on paper, 210 billion plus of spend in the US on cancer care, growing at double-digit rates. It's employers' top driver of healthcare costs. 40% plus of patients are going bankrupt. We're not following evidence-based medicine at least 50% of the time. So when you really look at all of those different opportunities to reduce spend and improve outcomes, we came up with about 20 different theses where there's 10, 15, 20 different companies for each. And I started getting more and more comfortable that I could, one, find enough different teams, different business models, and then different end buyers, both in terms of current customers and then exit opportunities from it.
How did you get started with the fundraising process?
It's so funny. I genuinely don't remember what day one was. You're in this kind of, and I mean, I'm sure you felt different versions of this too, but you're in this state of incredible conviction. And then you realize that, wow, wait, in order for this to happen, I have to go raise $1 from someone else. Otherwise, I'm going to have to go get a job again. And I remember day one, from what I remember, was getting the story aligned, like truly putting together. I wrote this really really scrappy deck that no one takes the calls really until they know that you could follow up and say, hey, I'll shoot you over a fund deck after. So I started thinking about fund size, allocation, what stage, why me, which was a very fun and interesting thought exercise that went into it. And I think the first bit of time it was get your collateral together, start talking to people who you really trust in the industry, right? Different VCs, other family offices, investors that you've gotten to know that can give you real feedback. And then I actually don't remember the first LP I pitched, but it was friends, startup founders, and some other folks that came in for much smaller checks, but I very much remember them in that. And I mean, just as much as some of the larger ones that came in later.
Did you have full conviction when you started that this was going to happen?
Oh my God. It's such a good question. Yes, I think you have to. Like, I think completely leaving, I worked at Time Care, a cancer care navigation startup in the space. And the day that I fully completely cut ties, because it was an amazing transition. The team was incredibly supportive, and we spent a bit of time kind of doing some advisory work, etc. And then there was that day where, okay, you're officially on your own. And I think I went back and forth between this is exactly what I should be doing, and then you send out hundreds of emails and calls to people saying, hey, do you want to invest? And people either don't respond or they say no. And there are so many different times during the journey where I was like, wow, maybe this is not the right fit, or this isn't going to happen, because it's difficult to raise money. And it's also, you're not just doing one job, right? You have to go raise capital. You have to manage your existing investors. You have to go find new startups. You have to do diligence on them. You have to help the ones you've invested in grow. And then on top of that, you have to do all the other legal, admin, and ops work. And there are some days where there aren't enough hours. And so I think that conviction is so necessary to be there throughout, but definitely got tested quite a few times.
I can relate to that. It's definitely an up and down. There's days where you feel like you're winning and days where you feel like you got kicked in the nuts a little bit. You had a good amount of experience coming into it, right? I mean, the experience at Time Care before that, you had invested at Oncology Ventures, which obviously one of the top names in healthcare, and then also had spent time at Alpha Partners. Was starting a firm something that you wanted to do otherwise, or like continuing a career in investing, something you really thought about? And how does that dovetail with what you're doing here?
First, it was incredibly helpful to be around it in so many different ways. And my first role at Alpha Partners, it was just two partners and myself. So I think I had a very fortunate opportunity to be able to actually see what even putting together a deck for fundraising is like. And I think a lot of junior analysts and associates are sometimes shielded from that. So I would say to folks listening, to the extent you could just get in the door at some fundraising meetings, there's no way that a partner would push back. I mean, it depends where you are, but I would say more often than not, if you go in saying, hey, I'd love to help you do research on what LPs I think could be an interesting fit, help you do prep, take notes, whatever it is for those meetings, just to start understanding how they think and act and what that part of the process is like, I think was incredibly, incredibly helpful. I have always wanted to start my own thing. I have, like, as I'm sure you and others listening do too, like a notes list on my phone of all of the ideas I've ever had. This fund, Oncology Ventures in particular, was the first time I was like, wow, okay, this actually makes sense, where I will tell everyone I know and have ever met that I'm going to do this, and good luck trying to do this better than I am with the passion I have and the clarity and thesis I have behind it. There are a lot of other ideas I had where I was like, I don't know, like if I went on to Neil's podcast and talked about this, there could be 20 other people that could just out operate me in different either startups or funds. And this was the first time I really felt that conviction to your earlier question around me being the right one to do it.
Are there surviving cancer yourself, huge one. Being at Optum and getting the experience on the healthcare side there, also huge. The experience at Time Care, also probably huge. Are there other things that kind of led into that conviction or that passion of this is what I'm going to do and I can do this better than anyone else?
I think it was, I spent a lot of time meeting who I thought were the smartest folks in different spaces and industries. And so I remember when I was at Alpha Partners starting to think about what my next career move would be, I was very confident it was going to be into the healthcare world and sphere. I looked at a few different industries. I knew I wanted to be sector specific because I think specialists win, especially at the early stage. And I remember I was looking at real estate and crypto and others, and I just remember going and interviewing all of the healthcare VCs, operators, regulators, strategics, and being the most impressed, excited I was after any other conversations. And I think spending a lot of time just having my ear to the ground for those, whether those were conferences, informal events, and just showing up and saying yes to smart people doing those things, building those networks. I think that was really important. That was more of a consistent throughout. And then the other piece is the importance of brand. So I think it's just reading. I have always read a lot, both for work and for pleasure. And I think the thing that I wasn't able to do in a real way at a lot of other places was write and reflect and share that with the industry. And I think this also felt like we have a Substack. That'll be my one plug for this podcast.
You can have more than one.
I like the one of the lessons learned from fundraising is if you just ask people for one thing, they are more likely to do that asking them for 10 intros or whatever else. And so it really did feel like it got where enough people I think have heard and read about enough different things where I actually felt like there was this opportunity to be a voice around cancer innovation in an attainable way. And it's very difficult to talk about, to understand cancer care, treatment, etc. And hopefully, in the feedback I've gotten so far is we make that all attainable and easier for folks to talk about, because right now we're at the point where people feel uncomfortable asking me what type of cancer I had. And if you can't even have that first dialogue, then how are we supposed to get to layers 2, 3, and 4? Plus, I had some comedy to each of the newsletters, which I also in prior roles would have had to get approved from different folks. So nice to have that free range too.
I feel like that's the number one reason why you started a fund. It's just so you can tell the jokes without anyone restricting you.
I truly, this has filled such because I do stand up at night and I do it around New York City and I've traveled to Boston and Nashville and other places to do it. But being able to just consistently do this async with folks is actually like turning out to be one of like the more interesting and fun benefits of starting this and having the platform. So
it's a great combo, right? It's one of those things that I feel like people don't necessarily think go together, right? Like cancer and stand-up comedy, but it does actually, I think, work really well. So you raised an oversubscribed $30 million fund one, which is super impressive. What did you do to build up that pipeline of LPs? Like, what was that process like?
It's still surreal, I think, that we're officially closed and doing it. We started out by doing the traditional route, right? So all of the fund to funds, emerging manager programs, all of the ones that are publicly listed. We, at the beginning, were not a good fit for a lot of those. We were almost every reason why a lot of those groups were passing. I was technically a first-time fund, solo GP, in a niche, yet largely growing space in a time where, I mean, you could talk to a bunch of folks about what they think about the current state of the market, and especially over the past 2 years, but liquidity for venture capital fund investments has been incredibly tight. And so I wasn't a spin out from, one of the top 5, whatever funds that has a track record for doing so. And so I spent a lot of time meeting them, learning, which was, I actually think, a very good use of time because 1, relationships for funds 2, 3, 4. And 2, it institutionalized us. So I ended up with this, when I went to some of these family offices and some of these strategics after that whole process, we had a really nicely done data room that I think they didn't see or expect from a fund of our stage and size. So then part 2 is we started getting a lot of interest on the strategic side. So we have quite a few cancer center healthcare system partners that have just been an absolute pleasure to work with. So City of Hope ended up being our anchor LP, and they were just, it was perfect, right? Because there's so many different pieces back and forth where they're sharing their opportunities with us, which is really interesting deal flow at the time of potential commercialization. We're introducing our portfolio companies to the right decision makers there. We're understanding their thesis areas and vice versa. And so I think we ended up then moving on to more of that strategic focus. And then once we hit that critical mass, hey, this fund is happening, we went back to some of the fund to funds, family offices, high net worths, and we're able to scale it actually pretty quickly from there, which was nice.
If you had to think about like this from a funnel perspective, can you give us an understanding, especially for like the first time fund managers or the founders out there who are going to be fundraising for the first or second time? How many people did you have to reach out to get how many pitches, to get how many LPs?
We had over, and I literally just did this. I didn't know you were going to ask this, but I was just doing this for my own reflection. We hit over 1,000 meetings. So I think it was like barely over. I think it was like 1,020 or something actual meetings. So in order to have those actual meetings, and that's for a qualified LP. That's someone who has invested into a fund or is part of a group that can do it, etc. And sometimes you end up, I probably had a couple hundred unqualified LP meetings where someone that maybe talked a big game or, had something on LinkedIn that overpromised what they can and typically do. And I would say cold outreach didn't really work for us. It was finding people, it was going to industry events, and it was finding and hearing about individuals on a person by person basis, asking for warm intros there. And once we got to our first meeting with a relevant qualified buyer, our hit rate in terms of closed investor was pretty high. I mean, we ended up with more than 99 LPs. We set up a parallel fund. So we had for sure over a 10% close rate once we got an intro meeting, which was, I think, relatively high for the market. But if you take in everything from outreach and non-qualified meetings, etc., it was probably closer to 4 to 5%.
Yeah, I think it's still great. And I would imagine it speaks to, one, you're strategic, right, in terms of thinking about who some of these LPs are, and they have reasons just beyond the pure financial for investing. There's a lot of synergy for them. But then also, I imagine a lot of people who are investing more from a financial perspective have some personal relationship. Was that something that you heard from LPs, like people, especially individuals and families, like they really cared about this issue?
Yes, I would say in the end, it was probably a third strategics, a third folks who either knew or had some involvement in the space or were donors or whatever else, then a third traditional fund to fund institutional type investors who 98% focus on a financial return, and then hopefully a few extra points of, we'll do good by doing well.
Yeah, absolutely. For the founders listening, do you want to kind of tell them what you're looking for, what's like in the strike zone, what you're excited about?
Yeah, so I'll share the fund first, and then maybe what some other VCs have been sharing recently that we've discussed. So for us, we're early stage. That is fairly broad. It was also why we got pushed back from some of those early endowment type players, because for where we are on the market and what we've been able to do, negotiate, etc. with, sometimes it's pre-seed, sometimes it's seed, sometimes it's Series A, but it's early stages of commercialization where folks have an idea, are starting to maybe bring on their first one or two commercial partners. And so it's anything that is data driven to improve cancer care research. And we've made quite a few healthcare infrastructure type bets where cancer is a top driver of spend or innovation. So things like in the clinical trial space, AI and ML, prior authorization, etc. We'll touch those. We do 250K investments on the small end, 1.5 million at the high end for initial investments. And then in terms of the other pieces, I think just being really clear, explaining to VCs what you're looking for in a partner. And we've talked about this with a few other folks this week, and where really spend the first few minutes asking about the fund. I mean, it's amazing how many founders we meet that just go straight into pitch mode, and you don't know. I mean, you should learn about like what the fund is doing. Are they actively deploying? How do they support? And just learn about them, because it is a real long-term partnership, and capital isn't just capital. So
that's definitely like a really valuable move for founders, because sometimes they'll find out at the end of a call there's no overlap in terms of the round size, the valuation, their plans, all that kind of stuff. How do you find the companies that you're investing in?
It has been mainly through our network, where they have come in through our strategic LPs, other LPs, founders in our portfolio. I spent a lot of time building our VC networks at my prior funds and startups. So I think it's a lot of folks that hopefully will continue to see cancer and send it our way. I would say that's some vast majority. We have had quite a few startups reach out, because the first thing, if you're raising a cancer startup, what you'll do is you'll Google how to raise oncology venture capital or some form of that, where we come up in SEO, which is why I ended up choosing the name. And that's been really helpful. I still would recommend that founders try to find a warm, curated intro. Aside from just reaching out directly, it doesn't hurt, and it shows that you can be resourceful, etc. And then I would say the last piece is we do a little bit of proactive outreach through conferences, and we hear about certain things, and we'll reach out. So we have a nice hit rate on that too.
I imagine the focused nature of what you're doing resonates with a lot of founders, right? It's really for anyone who's building in the space, it probably feels like a very tight fit, even from early on. And the same thing for me. I mean, if I see or hear of a company that's even remotely in the space, the first thing I'm going to think is I got to ask Ben about this because this is what he does. This is the person to talk to. So the name choice seems perfect.
I appreciate that, and that's exactly what I say. The two biggest reasons why I think founders so far have been excited to work with us. So far, knock on wood, we have a 100% success rate for wanting to get into a deal and getting into a deal. And I think it's for two reasons. One is we truly understand what they're building. They don't have to spend their first one or two meetings explaining healthcare, then cancer, then their business model within cancer, then how they're going to scale and get to market. We are with them from day zero because we've done it, built it, invested in it, lived it, etc. And then the other piece is we understand that the number one thing they truly need is help commercialization. No matter how good you are, no matter how scaled you are, the number one thing every cancer start or healthcare start, I mean, most startups in general need is support, getting it in, getting their product platform, whatever, in with the right decision makers at the right strategic groups, which we have spent a lot of time and will continue to spend a lot of time building and developing.
Yeah, I can imagine that's super valuable. What do you think makes, I want to talk about pitching for a little bit. What do you think makes for a great pitch? When you have met with a founder and afterwards you're like, wow, that was awesome.
I think for me, the number one thing is when founders are able to explain the how do they play on the field today and what the long term vision is in such a concise manner. I'm really excited. So how can I leave the call understanding, okay, if we get Neil in with this buyer, he has a clear cut business model. He understands what they're going to price it at, how that fits into their budget and workflow, how it's going to get implemented and used. And 5 years later, when they check in on how the company's doing, etc., they'll have real attributable ROI outcomes impact to change and expand that business model. And if I leave with both of those, which you kind of get into the vision, understanding the numbers, understanding the market, understanding the buyer, I think that's all kind of encapsulated in that piece of it.
What about the opposite? When you see, like, what's the biggest mistake you see founders make when pitching?
In our industry in particular, it is assuming that healthcare is more efficient than it is. And so I think that there's a lot of founders that will come and say, this is an absolute no-brainer. We built this amazing thing that does X 50 times faster or whatever. And then you ask them how they're actually going to implement this, and they're like, oh, once we're it, like it's going to be so easy to sell and get through. And those are always a bit of the red flags to me, is you really do have to, you'll learn a lot for how providers, patients, health plans really engage with your solution once you start having them engage with your solution. So I'd say the biggest thing is, like, as soon as you can, product market fit test and actually try getting this in the hands of folks, because the folks who underweight that early on, I think normally have a tougher ride.
We see that a lot also just in the form of like hubris. There's a lot of awareness, I think, of like people thinking of doctors as having kind of know-it-all personalities sometimes. And I think a lot of founders who are trying to sell to providers have that same issue where they're like, we're going to help them practice their field better, even though we're not specialists in that field. And the companies that are like, we're going to help the hospital make more money, often have shorter sales cycles, right? Because you're going into a hospital and saying, hey, would you like to make more money? Like any business, any organization is going to say yes. But you come in and you say, hey, I think you're doing your job poorly. Would you like my product that's going to help you do your job better? Oh, by the way, I'm not an expert in your field. It's a really interesting approach that some founders take.
It's spot on.
Let's talk about some of your pitches, some fun stories. Do you have any pitches that you remember when you were raising where afterwards you were like, yes, I nailed that. That was it.
On the positive side, I remember one was at a coffee shop. I won't share the name of the LP, but they ended up committing. And they essentially said midway through the coffee, what's your investment minimum? And I told them, and they said, okay, in 30 seconds, why should I give you that min? And I think I did it in like 28 seconds. And then he said, okay, I'm in. You get 30 more seconds. Why should I double it? And I did it in, I think, like 27 seconds. And it was like one of those days where I think I just understood what the market was seeing and reacting to our fund at that time, opportunity. And I think I very concisely both hit on his potential reservations and where we are and where we're going. And It was amazing. And I just remember like, and it was this, I think it was like a 6 a.m. coffee or something like that, where it was like a little bit of a test also is, do you care enough to show up and wake up at that time? Because no one who has plans at 5:36 in the morning, right? But some of the folks you end up working with, investing in, you can't fit in during their normal day to day. This is, an outside of work activity. And I think actually most of my best pitches were at either crazy random early times in the morning or weekends or late at night or in different forms where you're not going to be, if you want to start a fund or company, like you're not just going to be able to do a 9 to 5 calendar scheduling where you have your Zoom meetings, you go back to back. Like you're going to have to go truly all in. But that one in particular was pretty memorable.
Yeah. Do you remember what you said in those two 30-second
I
segments?
After it, I said, I wish I actually went up to the barista saying, like, is there any chance you guys like do recordings or like record like in case like something bad happens? And she's like, what are you talking about? So I really don't. I blacked out a little bit and I have been trying to re-replicate it. And I keep ending up at like a minute for each. Sometimes you just have to enjoy that it happened once and keep learning from it.
Yeah. Hopefully the next time it happens, I'll give you a full minute, so it won't be a problem at all.
Yeah, exactly.
What about the opposite? What about like a pitch where you just kind of knew it wasn't going well
Oh my
and there wasn't
God.
much you could do?
So many. There was one where it was actually my first time we had brought on this venture partner, and I was like, okay, it was like day 2 or 3 for him or whatever it was, but like early in on the first week, I was like, do you want to join this LP pitch? Just to get a sense of how I pitch and whatever else. We joined. I started by asking the LP, to tell us about themselves first, like, what you do. He said, no, you could just go. And I was like, okay. And I started giving the pitch. And I normally I never use slides, and I just give the brief overview first, and then I let them dig in from there. And my initial pitch is probably about 2.5 minutes. And I was maybe 20 seconds in, and he said, I'm just going to stop you right there. This isn't a fit. And I said, oh, like, do you mind sharing why? And he ends up getting really mad and frustrated, and like started yelling at me about how this was a waste of his time. And I was like, well, we asked you first, and we were also introduced through a warm connection. It was just such a weird, and then you just have to accept, acknowledge that, and just move on to the next pitch. But I remember it was like I had just brought on this new hire, and I was like, first of all, this is how I spend my days, and I remember it being quite tough. And it ended up obviously like we had a good attitude about it, and those things happened, but that was particularly frustrating.
That one was never going to go the way you wanted it to, and that person probably had a lot of other personal issues they were dealing with in that moment.
And there was probably something else that happened that morning or that day or whatever else, because it's a well-known institution. Like it was a bunch of things where like there's no way he is like that in every situation and call. But right.
Yeah. Let's talk about investing. Let's kind of switch over and focus on that. What has been your best investment ever?
Out of the fund, I don't know if I'll use the word. I won't do the best thing, but I will do the first. Was a company. It's now called Uncovery Care, and Hill Moss, who's the founder and CEO, was I think one of the people that was actually instrumental to helping me get in business as a fund. And I told a bunch of people I was launching the fund, and they said, "Well, if you're going to do it, you should meet her and you should invest." And it was one of those things where I think seriously it had been 10, 15, 20 people in a week saying you really have to meet her. And we met. She wasn't raising around, and what they're building is a data-driven survivorship care platform. And in a time where there's 18 million plus going on 19 million cancer survivors in the US, it's becoming a chronic disease. It was something where oncologists are not well trained in survivorship care. PCPs don't know how to deal with it. And what I ended up doing is I tried to use my oncologist as my primary care provider, and that doesn't work. And there were just so many personal business model timing pieces of it where I was like, wow, I would love to invest. The issue is I don't have a fund and we don't have money. And so it was just such an incredible experience being able to work with her to figure out how we could start partnering and helping and then investing when the time is right and when we had that capital. And we ended up doing it. It was our first investment out of the fund. We also put together an SPV. And then they ended up just raising a follow-on round from 406 Ventures, which is a fund we really like, and Tennessee Oncology. One of our other strategic partners came in, and they're an anchor partner. And so it was kind of this really nice all-in model of find something early on, understanding something that I think might take the market a little bit more time to get there, getting in on our terms so that when other folks do see it, we see a little bit of that uptick while helping to actually commercialize through our strategic partners. So the goal is to just rinse and repeat on recovery care type investments in a few other ways.
Yeah, you're really good at these stories. You're taking care of some of my follow-up questions.
I'll start doing shorter answers to give you more airtime.
No, it's good. It's good. What did you make of the fact that you had so many people telling you about this founder, and what was it that made her special?
I used to put, I think, a lot more weight into that. Now I think I don't necessarily know if it's always a positive. Like there are some quote unquote hot deals that I get sent by 20 people where I'm like, it's hard. You want to share your honest feedback, but maybe we think it's the wrong team business model, go to market strategy. She was one where everything was a check plus box for where we were. So I wouldn't say it's always a positive, but normally it means that they are getting in with, hopefully, if I'm doing my job right, the right folks in the industry to put themselves in a position to raise capital and get in the right doors. So there are definitely people where, like I've shared with my executive assistant, that there are certain people when a referral comes in from them, let's figure out a way to meet that group and get in the door with them over the next few days. Not to say that that's always the case or isn't, but that's how you build your reputation in the market. So I would say not all sources are equal. Not all the time when it's coming from a lot of folks doesn't mean it's necessarily a good deal versus someone that's just maybe spinning wheels, raising venture funding versus, if I get 10 intros from different CEOs at community oncology centers that we like working with for a founder, yeah, like that's a huge green flag. And then I would say in terms of what was true, I mean, it was just honestly, to kind of what I was sharing earlier, she had a very clear understanding of how product, tech, clinical, financial model all work together in a world with improved and enhancing and increasingly complex regulatory and reimbursement changes for it. So she just had a pretty comprehensive understanding of the industry, of what it took to build the team, of the clinical and the data focus, and also the energy. Like if you ever have the chance to meet her, it's someone that I think is kind of infectious with their personality and desire to like truly do good in this, which I hope we do across the board. One of our fun theses is that if we invest into companies with the right business model, that is what's going to get into the hands of the right executive decision makers and stakeholders, which is from then going to improve care and outcomes in a more meaningful way than just maybe a pure nonprofit type strategy.
I agree with that 100%. That's part of our thesis as well. Let's talk about your worst investment, or maybe some mistakes if you want to categorize one as worst. And we can leave out names to protect the innocent, but what can you tell us about that kind of experience?
Truly, so far from Oncology Ventures Fund 1 portfolio, we're feeling pretty good. I mean, it's kind of all been up and to the right with founders that I am so genuinely excited to continue working with. We're still relatively new, and we just committed to our 9th investment, about to commit to our 10th. So we're building that portfolio. There was one investment I remember making, I won't even name the fund, but it was one of those things where if you actually think through the like pre-mortem, if you write those where, okay, what has to go wrong for this investment to fail? And it was just all of those happened. And it was both foreseen and unforeseen risks where they just missed it on everything. And then from there it was difficult to raise more capital and kind of burned. And so I think I learned a ton from that investment around one, like really diving into unit economics and cash flow and understanding how to maintain that either commercial or venture follow-on in such an active way where I will not let another company get to that stage where we will either hopefully help them bring a net new customer, so hopefully non-dilutive revenue capital, or make sure that the right other partners just give them a little bit more time to breathe to figure it out.
Timing is everything in more way than one. Do you like to talk to founders before they're raising, or do you want to wait until they're actually in market?
100% talk to them as soon as they are interested in talking to me. Has anyone said the opposite?
And that's a newer question. There are folks who say the opposite in terms of the advice they give. So they'll say, yeah, some folks will say, don't talk to investors until you're raising. Some folks say the opposite. I think more say the opposite, but it's a lot of VCs on this show, so they're obviously biased. I think the founders kind of trend the other way. So we're gonna move into the lightning round here. Just a few quick questions. Some of these are lighter, some of these are heavier. But we'll start with a fun one. What food would you eat if you can only eat one food for the rest of your life?
Chicken parm with spaghetti al vodka.
All right, very precise. Is there like a specific place you like that from, or is this like home cooked?
We are narrowing it down to our top three. I should probably do that over a weekend and do like a little bit of a real competition. But there's this new place called Sam's Pizza or Italian in Murray Hill in New York that is so good. Lena's, Lena, is amazing for that. And then Sauce in the Lower East Side.
All right, next time I'm in New York, we're going for that.
That is a perfect follow up for this.
Yeah, please. Slightly tougher question. What's the hardest lesson you've had to learn in your career?
Oh my God. Less is more. I think for so long in so many different ways, even looking back to my first few LP fundraising emails, I was like, how do I not include all of this stuff? And people don't have time, as I now give a rambly answer for this. But I think that making everything more concise, I actually think, and reflecting on feedback I've gotten in prior roles and jobs, I think a lot could have been saved by truly understanding what people truly needed to know in certain situations in such a concise manner. And the companies that send us update emails that are just a few key pieces, remind me what you do, a couple wins, and then maybe an ask, I read every single time. The ones that are, where you have to scroll and scroll and scroll, it's easy to get lost. I don't know if that's a technically difficult lesson, but I think that it's one that took me a while to learn because I don't think I got enough direct feedback from folks that was a reason for certain misses.
I think it's a great answer. I still I think struggle sometimes with like how little or how much to share in certain contexts, and I think it's something that founders have to learn and personalize as well. We're going to end on some bright notes. What's been the best moment of your career so far?
Oh my God. The day we hit, there were a few different pieces within the fundraising process, but we had our in-person limited partner event in New York City, and we did it at NASDAQ, and it was so special. So my family came, all of the CEOs from our portfolio companies came, the decision makers and leaders from all of our biggest investors and strategics came. And we had like our logo with the thing outside of the NASDAQ HQ in Times Square. And we took a photo with me and all of the CEOs of the companies we invested into. And it was, I think, the elevator ride down to go do that I was like, wow, this is like pretty cool that this is real and happening. And I am just very grateful to be surrounded by a lot of folks that want to work with us in any capacity and do something that I really do think we're going to improve cancer care and research. And I really do think that in the way we're doing so, it's going to be a really exciting financial return for the CEOs and the LPs. And so if I could keep doing that for my career, but that was like that one like elevator ride down, I'm going to remember that for a while.
Yeah, it's the best moment so far. Maybe there's few more to come. So last question for you here. Who's helped you the most in your career?
Oh my God. I have been very, very fortunate with a lot of incredible mentors, partners, people. I would put them into a few buckets. One, my family's been amazing. Like father, mother, sister has been there, supportive, sounding boards, helping in whatever way they can, which is just nice to have throughout. And then there have been a few people that I remember, like Charlie Bonello is one that has been, he founded a company called Vivi here. He started Grand Central Tech, if you've heard of that, in New York. And I met him when I was like 15. And since I was 15, I have called him for like every career decision thing in my life. He's acted as a reference. Johnny Immerman is the founder of Immerman Angels. It's my favorite cancer nonprofit. Does peer-to-peer cancer support. I did it when I was going through cancer. And he is one of the people where his network is your network, truly. and has just been so generous with his time, resources. And there's so many more people. I have one friend who actually came on board as an LP who ended up maybe helping us raise the most amount of capital through his friends and network. And so he's been really helpful too. So it's been truly a team effort.
Everyone who comes on, I think, has that feeling when they reflect on it, and it's great to acknowledge those folks.
And I love the question, Neil, because I should be reflecting on stuff like that more. Like that just made me happy thinking about, and I do not every day think about all of those people who helped. Like, I don't know, some days you're just sitting at your computer screen and typing away, or in back-to-back Zoom meetings, and it's so important to reflect on the positives and the people component.
Yeah, I agree 100%. I think when we look at the past, we're often looking for learnings, and we're looking at regrets or things we wish we did better. And it's really important, I think, to pause and look at the things that went well, and the people that we've helped, and the people who helped us. So it's fuel for the future. You've had amazing success and progress so far, and I'm excited to see what comes next for you, and really appreciate you joining us for an episode.
I appreciate all the kind words and for having me on.
Thanks again for tuning in to this episode of Money Moves. If you learned something new or just loved this episode, click below to subscribe. See you next week.